everyone, my name's Rebecca Pedley and I'm a research fellow from the University of Manchester, and we're just going to talk today about an evaluation we're doing of 42nd Street's online service for children and young people.
Hi, I'm Rebecca Gosling. I'm one of the young person co-researchers on this project. We'd also like to mention Ezra Rose, who's the other young person co-researcher. Unfortunately, she couldn't be with us today.
So this is just a quick overview of our team. There's lots of people involved in the project, and the lead investigator for the study is Professor Karina Lovell, but we've got colleagues from 42nd Street and Health Innovation Manchester and from the University of Manchester Applied Research Collaboration involved in this project. Just a quick overview of what we're going to talk about. So we're going to give a bit of a background and introduction to 42nd Street and what their online service looks like. Then we're going to give an overview of our study and our evaluation. Then Beckie's going to talk a bit about how we're taking an inclusive approach. Then we're going to talk about our progress so far and some of the challenges we've had to date in making sure that we always have kept an inclusive approach across the study. And then I'm going to summarise with some conclusions. So 42nd Street is an innovative Greater Manchester-based young people's mental health charity, and they've been going for a long time, 40 years now. But their online services are more recent, and they've been developing those online services between 2017 to 21, and it's been informed by research evidence and co-developed with young people. And the service aims to overcome barriers that disproportionately affect particular communities and vulnerable groups. And there's a focus on inclusion. They target, they try and reach young people who are from the LGBTQ community, young people with experience of the care system, young carers, young people experiencing cultural barriers, and many other young people as well. And so this is a kind of an overview of what the platform looks like where you log in. So each young person who accesses the platform, it's open to young people aged 13 to 25 in Greater Manchester, and they can self-refer. And they all get a username after they've registered, so they can log in and access the service. It's a confidential service, so young people can access it even if their parents haven't necessarily had to get involved in that process of registering. And there's lots of different types of support that are on offer through the service. So there's weekly messages, and that's where young people can send messages to a worker and they reply at a certain time every week. There's live text chat, which is more of a live instant messaging type service. And there's online drop-ins where young people can just drop in a certain time each week. And there's also groups, so there's a chance for young people to meet other young people, and there's lots of different themes to those groups within 42nd Street. And finally, sorry, just to mention that some young people are also accessing the service via Teams, which is a bit more similar, I guess, to their traditional offering as a service, but it's obviously on a video conferencing modality. So the service was soft launched in 2019, but obviously during the COVID-19 pandemic, there was more of a shift of their services over to the online platform. And as this is slightly out of date now, sorry, but as of May 2021, there was over 900 young people on the platform. This figure will have now increased since then. So the overall aim of our evaluation is to evaluate the service to inform a toolkit, so some resources and guidance that will support the rollout of the digital platform in Greater Manchester and more widely on a national basis. And we want to do that through carrying out the interviews and interviews with young people and staff from 42nd Street to see what their individual views and perspectives are of using the online platform, and from the staff's perspectives from delivering the online platform. And we're also looking at the routine questionnaires that young people complete when they use the service. So that is not the focus of my work and Beckie's and Ezra's. We are more focused on the interviews with young people and staff. But just to acknowledge that that work is also going on. And we want to be able to develop this toolkit that will be made available to make this kind of intervention offered more widely. And so just briefly about the design, I'm just going to hand over to Beckie for this part.
So we're doing a qualitative research study at the moment. We have aiming for 15 to 20 interviews for both young people and the staff. And we're going to have questions exploring the staff and service users' opinions and perspectives about the online care platform. We have 2 young person co-researchers who are part of the research team, which is myself and Ezra. And we've also had some involvement from the 42nd Street Peer Ambassadors, who are a group of young people from the service. We tried to take an inclusive approach on this to promote digital inclusivity. So we've done this through having qualitative interviews. These enable an in-depth understanding of the young people's experiences and takes into account any things that may help or hinder their access to the online support. We've used diverse recruitment approaches for young people. So we've used posters, word of mouth, talking to workers. We've also sent direct invites to key target groups that 42nd were keen to reach, to kind of hear from people who are seldom heard of. We've also included the young people who might have signed up to the online support but decided not to continue with that, or maybe they started the registration process but never got around to actually joining the support. Just to see if there's any barriers related to digital means which might have impacted why they didn't decide to continue. We've also got a different choice of interview modalities. So we can do the interviews on Zoom, through WhatsApp messages, or on phone. So there's obviously a lot of young people's involvement. So myself and Ezra are the co-researchers. We've had a lot of input in the kind of advertisement materials, so the information sheets, the posters. We've attended a lot of meetings. We've also given the opportunity to interview some of the young people, just to have someone there who's maybe of a similar age and a similar experience to them, if they want. And we've also been involved in the meetings with the peer ambassadors, who are also young people who have been involved in the research process. So far, we've managed to interview 7 young people. 4 of these, myself and Ezra, have taken part in. Rebecca's interviewed 12 staff members. The recruitment and qualitative analysis is still ongoing at the moment. As we've had a few recruitment challenges, the progress has been a lot slower than we'd hoped for at this point, in particular trying to recruit young people under the age of 18 and those who may have discontinued. So the ways we tried to overcome these recruitment challenges, we've had regular meetings to try to discuss any solutions to recruitment challenges and ways we can maximise inclusion. This led to a series of new advertisement materials, so we developed new posters from this, and we developed new recruitment strategies, such as providing new ways to take consent from young people, so we can now do that via text chat if people are more comfortable with that. We've also created some Instagram story style slides that are going to be shared on social media to try to recruit people from social media. And we've also asked ethics for approval to the workers so that they're able to kind of discuss the study to their young people at the end of their final session.
So just to conclude, when carrying out this kind of research, we really need careful thought and planning to ensure that an inclusive approach is taken, and to make sure that we're not excluding those people who may be affected by maybe digital health inequalities from taking part, because it's important that we capture their views as well. And we really need to take or undertake ongoing monitoring and consideration of how we might need to adapt our processes as we go through this kind of research, because in our case, we've noticed that under 18s are not coming forward so readily, and we're not capturing the views yet of people who have not continued with the platform. So we've had lots of discussions about that, as Beckie said, and we've taken steps to amend the way we do things to try and make sure we reach all young people. And the input from people with lived experience and involvement of young people as co-researchers has been really invaluable at all stages of this study, in making sure that we're able to reach our objectives. So thank you very much for listening.
Thank you.